Yeah, so the lie being that you're individually responsible for your health, and if you are disciplined enough or have enough willpower, then you can, it's your job to do it.
What do you think we as a country should do to make our diet more healthy?
First, we need to start with children. We're feeding them cheap, empty calories, largely ultra-processed. It's a massive problem that we basically have in NHS, but it's not really a health service, it's a disease service. You're sick, and you go in and you say, can you help?
I mean, on vaccines, America is massively pushing back. What does that mean for American health?
America's health's going backwards. I mean, they're having measles outbreaks. Children are dying of measles, which is preventable. It's a vaccine-preventable disease. We are going to see a resurgence of things that were eliminated or gone.
Hello and welcome to Ways to Change the World, the podcast where we talk to the thinkers, innovators, the radicals with the big ideas on how to change the world for the better. My guest today is the public health expert Devi Sridhar, whose insights and arguments came to the fore during the COVID crisis, but who has been researching public health interventions since she was a teenager in Florida with a father dying from cancer. She had her own brush with the disease 2 years ago, just as she began writing her latest book, How Not to Die Too Soon. Fortunately, she managed to do just that and joins us now. We'll get to that collision with your own mortality in a moment. But first of all, if you could change the world in any way, how would you change it?
I think it would be to prioritize health and well-being in our everyday lives and have healthy, long aging in a vibrant way.
But your book is all about really how we've been sold a lie.
Yeah, so the lie being that you're individually responsible for your health, and if you are disciplined enough or have enough willpower, then you can, it's your job to do it, instead of actually looking at the fact that we are social beings who are within a community and are receptive to those forces.
Because, there are so many industries now around health, diets, how we should live, what we should drive, all those sorts of things. And what you're really saying is it's much more than individual responsibility. Governments have got to make big interventions.
Completely. So it comes from looking at places, you might call them blue zones, or places where people live long, healthy lives. If you look at the individuals within them, it's not because they're individually, in a sense, every day thinking about it. It's just they're just living their life in the way community has been constructed and the government has created policies. And so my takeaway was not that we should be looking and thinking, I need to sleep like someone in a blue zone, or I need to eat like someone there. It's actually saying, how do we create more places and have policies that let us just live our lives, but through living our lives, we actually end up in a healthier way.
So what is a blue zone in public health?
So a blue zone are places where people tend to live close to 100, have low rates of chronic disease, low rates of hospitalization. So examples would be, Okinawa in Japan. They've looked at Sardinia in Italy. They've looked at, different communities across the world, and they're thinking, why do people there live longer, healthier lives? And a lot of the research has pulled out individual habits instead of actually looking at the community itself.
Which
and
is
the
why
policies.
we get hung up on Mediterranean diets and
Exactly.
all that kind of thing.
Exactly, yeah. And the Mediterranean diet is great. It actually has been shown to have massive health benefits, but it's easier if everywhere you go is serving Mediterranean diet food, and you go to school and kids are eating that, and you look in the local supermarkets and that's where you can get the fresh produce, and it's affordable and it's delicious. And I think the problem is trying to import that without actually changing the food culture that we're all part of, or what you can actually do in your daily life.
So what are the big lessons from those places where people are living long and healthy lives?
Well, the lessons, and they won't be any surprise, are diet, physical activity, low levels of violence, strong levels of community, good access to healthcare, clean water, clean air, not much road traffic accidents or chance of dying, in your everyday life on a cycle or walking. And so actually things that people would be like, oh yeah, that makes sense. But the difference being that those are ingrained in policy. It's not because individually you're doing anything about it. It's actually how they're constructed.
So this is about big government action.
Exactly.
And government's looking at this wrong?
Well, I think it's too easy for governments to say, well, actually, why should we care about that issue? It's an individual thing. And actually, if you're willpowered enough, you can make sure you get your exercise. Part of me is like, if you look at the populations that get the greatest level of physical activity, it's built into their daily life because cities are built around walking or cycling or public transport. There are options, alternatives to just being in a car, being sedentary. So the idea being that just running fitness campaigns, YouTube campaigns, Dubai has tried a free month of fitness, don't actually get the population as a whole moving. It's actually the invisible drivers of how do people get around a city, how do kids get to school, how do people get to work, and how do you make it that actually there are more kind of what we call active travel options. But it has to come from, let's say, design of how you actually design a city rather than individually saying to people, go run your 5K or go, some people will do it. But again, you're almost reaching the fit who just want to get a bit fitter. You're not reaching the bulk of people who are sedentary, who are just like, I do shifts, I've got to care for my parents or my children, I don't have time. So you have to make it inbuilt into the city and into their lives. So it's invisible, accessible, and then people can do it.
Now, you begin the book with your own brush with cancer. Just explain what happened.
Well, it's just me living my life. I think of myself as quite healthy, young, doing all the things I'm supposed to be doing and going.
You're a fitness obsessive, really, aren't you?
Well, a bit too much. Yeah, probably err on too much. And my idea being like, I just went for a screening, and that's part of the NHS. We all go for regular screenings. You get your letter, and I went in, and they came back, and they said, well, actually, we found high-risk HPV, and we found abnormal cells. It looks like there's a likelihood of cancer. You need to come in for an appointment. And then my struggle to get an appointment, because the NHS in Scotland, I guess similar in England, has major backlogs. And this was just after the pandemic. So actually, they had all these women who had just been pushed forward, not having those screening programs running. And I was like, my lab results have already taken a couple months, which means this is looking almost in the past. So who knows what's happened since then? And then trying to get an appointment when it'll be 6 to 9 months. And knowing from being American that in the States, you get your results within a couple days and you get your treatment within a week. So actually, you're like, how is this? But I guess the point of bringing it up was to say, one, we're so reliant on the healthcare system we're in. I couldn't treat myself. I couldn't fitness my way out of this or eat, my Mediterranean diet. I was reliant on the healthcare offering, but also the idea that, there are things where we actually do need society to step up. And me having access to a screening program, getting the treatment, which I did, living longer, had to do with having an NHS, which was able to be provided, which is accessible and free at the point of care, which is one of the points I wanted to raise, that in the States, you'd have that, but you're paying tens of thousands of dollars. So in a sense, your choice is, do I just risk it, might go away, or end up paying $30,000 for it? So the idea being that actually before we start saying the NHS doesn't work, it has problems, it does, that actually there are barriers to care in a lot of other countries, and it may not be a wait list, it might be a high bill, or it might be not having doctors. And so also to bring some comparative reflection into where the NHS is compared to other systems.
Okay, well, let's talk about the NHS for a little bit then, because obviously that's the government's massive focus. They're piling more money into it.
Yeah.
And as every government I can remember, they are going to talk much more about prevention being the key.
Yeah.
But, the truth is they don't really get there, do they?
Yeah, it's a massive problem that we basically have an NHS, but it's not really a health service, it's a disease service. You're sick and you go in and you say, can you help? And I think the real thing is it's really hard to invest in prevention because the focus is on A&E wait times and ambulance wait times and the person dying of the heart attack. How do you actually go backwards to say, how do we reduce the likelihood of that person having a heart attack? So for there are things that I've thought about, like, why don't we have a yearly annual checkup where people get their blood pressure, which would tell you very clearly a sign of, are you at risk of a stroke or a heart attack, where you have support, in the sense of this is what you need to do in terms of a plan to get your health on order. And so actually having to make those decisions to shift away from hospitals to actually community care and doing it in a concrete way. So looking at what are the 5 things people going into A&E for or taking up the hospital budget? How do we work back to the community level to start trying to unpick it? It'll take years. And I think that's the problem for governments. They don't happen overnight. It happens over years. But I think that's the only way, because we will never treat our way out of this crisis with the NHS, an aging population, chronic disease, more and more people living longer but dependent on social care. The only way is to rethink it and think, how do we make aging in a healthy way, an independent way, where you're not reliant on a healthcare system, where you actually can touch base with it in a preventive way, but not wait until you're actually very severely ill before you're going in.
But aren't we in a catch-22 when it comes to the NHS, which is that it is so busy treating the sick that it doesn't have the resources to do all the preventative work and the annual checks. If you booked everybody into an annual check, you wouldn't be able to get a GP appointment anymore.
True, and
you're
that's
sick.
Completely. And I think that's the catch-22 we're in. We're almost having to work it back, right? Because there are people who need care for diabetes and chronic conditions and hypertension, but actually, how do you work backwards? And I think there we do have to be honest about the past 15 years investment in the NHS. The investment in the NHS hasn't kept up with other countries. France, Germany, they do spend more per capita on providing healthcare. So one thing is saying we are coming out of a pit where actually we have long wait lists. We have to invest in it, but invest in a smarter way. The government is talking about it, and I think that's great. But the question is, will that actually deliver? And will they actually be able to do that and create the bandwidth for that?
I mean, politically, we've got ourselves into a situation now where it is very common for people to say the NHS is a money pit. And you can pile more and more money into it, but it won't really change outcomes. How has that been allowed to become the norm?
Well, I think there's also like this idea that like somehow other places are better or have it all figured out. And that's why I wanted to bring up the examples of the States or even India, where it's out-of-pocket care. You literally go to a doctor and 70% of people are paying for their care out of pocket, which has its problems. But I think the only way is to say it's not piling it into the NHS. It's saying this is what we're going to put the money in for these priorities. It's going to go towards prevention. And this is the service which we're trying to keep for the benefit of everybody. But I think where we will go down the black hole is if we don't invest in primary. Primary prevention is things like diet, physical activity, smoking, alcohol, the drivers. Secondary prevention is like things like diabetes screening programs, blood screen, basically saying to people, these are early indicators of disease. Let's get on it early. If we don't invest in those two, there's no way you can keep up with an elderly population and health services. No country can. So you have to rethink it and think, okay, how are other countries managing to have aging populations which are healthy? And that's why in the book I talk about Japan. Because Japan has like whole football teams of people over 100. Like they're still playing on a football team. And I was just thinking, what a fascinating place where actually aging independently in a healthy way has been normalized. And how do we actually think of that and think, are we thinking about aging, the idea you get older, you get sick, you die? Why is that normalized? Instead of you get older, how do you remain independent? How do you remain healthy? And actually save some of that budget where we're spending a lot on, the last 20 or 30 years of someone's life.
Okay, so how do they have 100-year-olds on football teams?
Well, their diet, a huge one. So they have very low rates of obesity, chronic disease. Going back to children, what they offer their kids in school meals, they get 9 fruits and vegetables. Here we're trying to meet 5. There it's 9. They manage to kind of support people, effective healthcare system focused on prevention. And so they've struggled with smoking rates, but they've brought in legislation to get smoke-free, brought them down. Very low rates of respiratory diseases because they've had clean air initiatives and net zero focus. But I do want to put like a little asterisk because they do struggle with suicides and mental health. So Japan in some way is, you think, great in all these different areas, an exemplar. And then you go to mental health, and they are actually probably the country where more people died of suicides by October 2020 than of COVID-19. And it wasn't because of lockdowns. That was a trend continuing. But they are the outlier. And so in the sense of you can maintain someone physically, but actually they do struggle with mental health. And so just to not paint them as the actual perfect population, they have struggles too.
So take diet, because diet is the ultimate personal responsibility in our society. And there is endless industry around, books, websites, fads. What do you think we as a country should do to make our diet more healthy?
Well, I think first we need to start with children. And I think everyone would agree that children are not responsible for their own diet. They're generally fed what their parents feed them at home or what's in their home and what's at school. And if you look at what's in school meals or around schools, it's basically junk food. We're feeding them cheap, empty calories, largely ultra processed because it's cheap, it lasts forever, and there's a big lobby because it's a big market. And so there, I'd say the first thing to look at is we think we're saving money on school meals by saying like, actually, we're only going to spend 50 cents a meal or 45 cents a meal. Pence, sorry, not cents. But then you go and you look at what you're spending on a child who develops diabetes by age 19, type 2 diabetes. That's care for the rest of their life. And so I think there's this false economy of trying to save money on something. So school meals would be one. So if you look at the places reversing childhood obesity rates going up, South Korea, Japan, Denmark, those places have focused on children and the school environment, meaning not just, high schoolers or senior schoolers might want to go outside of the school. So what is the environment? I think another one is affordable options. Like we know since Brexit, that fruit and vegetable prices have gone up quite radically, like cucumbers up 200%. So when someone goes in to buy a basket of goods, which you'd say are more nutritious, is much more expensive than to buy them that are cheap. And I think that understanding that actually we have to figure out how to make healthier options cheaper and more affordable and accessible, because it shouldn't have to be that that actually to feed your children properly or feed yourself properly, you're going to have to actually pay so much more. And a lot of people just can't in their budget.
I mean, through subsidy or changing agriculture or all of these things.
Yeah, and I think there's innovative solutions. I bring up, in the book, I really try to give practical examples because otherwise it sounds like fairy tales, right? And one is around Wales, which started actually what they call a courgette trial, zucchini trial. And what they said was that they were going to, with schools, go to whole, food manufacturers and then the middlemen and say, we are going to guarantee you a market. We're going to guarantee you all school meals. If we guarantee you that and you guarantee quality, can you provide that at this price? And because they were guaranteed this market for a certain amount of time, they were able to bring down the price and they integrated into school meals. So actually, there you go, a vegetable, affordable in a school meal. And they're trying to trial this with other vegetables in the sense of if you create a market, you can guarantee it, can you actually get producers to meet the prices that you need? Because a lot of it comes down to price. So I think they're innovative trials of actually trying to see how can we shift things. Denmark is another one. They started a system of what they call kind of keyhole labeling, where they label products to help identify for people when they go into a shop what are healthier options. It seemed to work well until the barrier of cost came up. People said it's more expensive. So they looked at subsidies for those, saying you can't just have sin taxes and tax unhealthy thing. You have to make it more affordable. So I think there it's kind of slowly shifting it through these levers of kind of cost, affordability, education, but schools as well is a great place to start with children.
And about shifting the spend away from what it costs to fix people or treat people.
Exactly.
Into what it costs to prevent.
The problem is it's two separate budgets, right? So one line is NHS and one line is education, where school meals are coming from. And so you think you're saving money because you're pulling it from school meals, but you're spending it because people are getting sick. So having that joined up thinking of actually how do we join it up to say we might spend a bit more there, but the savings will come. They might not come for 5 years or 10 years, but how do you have that longer term thinking?
But how do you get ordinary families who are struggling with their weekly supermarket shop, even if you subsidize the courgette and the cucumber, to buy those things? When the fact is that ultra-processed food is tasty, cheap, easy, can be stuck in the microwave, doesn't require all that cooking effort and knowledge that we don't have as a society.
Completely. And there, I think there's policy levers. So if you look back, it's a bit different, but similar as you could take smoking, something that you would have said 30, 40 years ago is addictive. People like to buy their cigarettes. Smoking was ubiquitous in pubs and cultures. You would have thought, how are you ever going to do this shift to a world where actually people aren't going to have that? And they managed to through policies. That's one of Britain's success stories, right? Of actually using different policy levers that now smoking rates have declined rapidly. In other countries, like how did Britain do it? Well, it was through a mix of creating different zones where you can't smoke, right? Smoke-free places, make it taxation targeted, education, making it easier to quit. So you go to pharmacies, you get support. And so I feel like we almost need a similar kind of strategy for diet. We're thinking through how do we use the policy levers we have to start shifting it away with recognition it's not an individual choice. That actually, in the end, people are making choices based on how much money they have, how much time they have, how much knowledge they have, and that there is a reason there's a socioeconomic gradient for obesity, right? And also that it's easier to stay within a healthier weight in Japan than it is here. That means there's something about the food culture. It can't just be individuals having less willpower or anything like that. So
there is a basic bias against the nanny state in Western democracies. So how do you persuade people that regulation is good?
You just look around us and how much of our life. So why have we not had a mass shooting in a school in Britain? It's because of Dunblane in Scotland, where there was a shooting and parents came together and said, no more guns. And then it progressed through various, both conservative and Labour governments to the point where you can't easily find a gun. Recently in Edinburgh, they did have a student who was arrested who had massive plans based on Columbine for a school shooting, even where they would stand, what they would do, couldn't get a gun. That was the difference. Otherwise, that would have had basically planned it in great detail, the one piece missing. So when people look around and say, oh, nanny state, I'm like, is that a nanny state? That actually you can't easily buy a gun? Take another one, clean air. We know increasingly the damage that air pollution does. If you're in some place like India, it's the equivalent of smoking 50 cigarettes a day. Half of kids in Delhi have damage to their lungs. And then you take Delhi and you say, okay, that could be London. That could be any of the big cities that have large populations, cars, diesel, manufacturing, industry. Why doesn't London have air as bad as Delhi? It's because of all the measures brought in, by both conservative and Labour mayors, saying actually we want to try to keep London's air as clean as possible. with the balance of obviously we need some cars, we need some things, but do you want to live in a world where, you have lockdowns like they do in Delhi because the air is so bad? So people are staying inside because they can't breathe outside. That's regulation. That's nanny state. And then go through roads. If we had no walk, there's so many ways. NHS, that's a regulation. So much of our lives that we take for granted is policy measures that keep us safer and give us freedoms. We have the freedom here to send your kids to school without being shot.
I mean, the government's just announced, over £100 billion of infrastructure investment. There isn't any part of that conversation that is about making sure that infrastructure makes us walk more or cycle more or anything like that. I mean, why, and you've worked closely with governments in Scotland. Why is it so hard to make this part of the conversation?
I think it's hard because there's a focus on immediate returns. They want to know tomorrow. And I think there's a real problem now with constant pressure to focus on other things. And I content later in the book, who wants to be a politician? Because you get constantly hammered by things. So if you're trying to raise infrastructure, then there's the issue of you're trying to take away cars. Why are you trying to take away cars? And you're saying, we're not taking away cars, we're offering you options. I think the nicest thing in Edinburgh, and they've tried to do this 15-minute city, is you can walk, you can cycle, you can take a bus, or you can take your car. Taking a car might be a bit more expensive, but those are the options. It's more freedom. And I think the problem, though, is when you try to say it, you just get hard, but you're trying to take away cars. The green agenda is the woke agenda, blah, blah, blah. And I feel like it becomes hard to be clear through it. So I do feel for politicians because I feel like they're being boxed in sometimes by being hit by kind of half-truths and trying to defend that, so can't progress the healthier agenda. And I feel it here as well. I mean, hearing the debate. When Labour came in, there was great promise about prevention, about healthier meals, about these kind of things. And I know they're trying to do it, but it feels like, when the Prime Minister comes out, Keir Starmer, he's talking about immigration. I'm like, why are we talking about immigration when we should be talking about making life better for people? What do immigrants have to do with that? It's a different conversation, but it sometimes feels like he's been forced into that instead of keeping to the agenda of actually what makes life better for people living here. And I can tell you, I don't think it's immigrants who are the reason that everything is not working, and that's an easy out. But that's one of the things that gets me is the distraction. So politicians get dragged down that debate instead of focusing on the key one, which is how do we make life better for people, healthier, easier to live. And actually that requires investment in public services and in infrastructure, but in ways where you think about active travel, walking, and affordability.
So how hard is it as a government advisor to get them to realize that these sorts of interventions could actually change lives? There's a sense in which when somebody like you comes along and says these things, it's like, well, yes, I know, in an ideal world,
yes,
and we could spend all of that money, but in the real world, we can't do all of that. So, we're going to get on with this.
Yeah, and I guess that's partly why I wrote the book. I give examples. I give concrete examples for every single issue. Mental health. They say here we can't provide enough therapists or GP appointments for everyone who needs mental health care. Wait lists are 2 years long. I'm like, okay, how is India dealing with this? So India has started to do experiments looking at lay therapists, people you train for a month who go into communities. And actually they found depression rates go down massively. Just having someone trained for a month who can sit with you in the community and then say, actually, I need to escalate you because you need to go see a doctor. We've had GPs doing that, right? GPs are basically that service. GPs are overloaded because they're dealing with mental health on top of everything else. So my thing is, well, why wouldn't we learn from India? If they're able to do lay therapists, why can't we do it here? And I think that's what I've been trying to do with government, politicians and ministers, and just saying, you say it's too hard. Why can't they do it? You say it's too difficult. Why are they doing it? And I feel that way about the States now. I mean, coming back to being American and living abroad, you go to the States and you say, imagine not having mass shootings. And they say, oh, that's a pipe dream, never happened. I'm like, nowhere else has this. But because they're in their bubble, they can't see beyond it. They're like, we love our freedom. I'm like, Brits would say they love their freedom. Australians love their freedom. Well, we have a history of it. Serbia has a history of it. Colombia has a history of it. So many places. And so I think taking away the exceptionalism of being you're not exceptional because you're American. Look at the rest of the world. They just have done policy in a different way. And I think that's what I try to bring up to ministers, international examples.
On vaccines, America is massively pushing back. They've announced this review of all vaccines. They're looking at MMR again. as if there's anything to look into. We know for a fact there's nothing to look into in terms of the link between MMR and autism, but they're looking into it again. They've announced that they're going to take away the giving of COVID vaccines to children. Now, we've done all that in Britain already, but in America they
were
still
cost reasons
giving.
here, though. So we do it here for cost, not for safety, I think. So there's a difference.
Right. So, I mean, so what does that mean for American health?
Well, America's health's going backwards. I mean, they're having measles outbreaks. Like, children are dying of measles, which is preventable. It's a vaccine preventable disease. We are going to see a resurgence of things that we considered like that were eliminated or gone.
But the Trump administration and the MAGA crowd would believe or argue that you're part of some sort of corrupt, giant, sort of farmer-driven cabal that is trying to sort of pull the wool over the population's eyes for the pharma companies to make money.
Completely. And that's what you're painted at. And it really frustrates me. And that's why, like, I do mention in the book why I went into public health. I had an offer. I could have gone to Harvard Law. I could be in, Wall Street. I had other options. And most people in public health are like me. And we've chosen a career where we want to actually look at the best data, analyze it, talk to other experts, and help all of us, including ourselves, live longer, healthier lives through public health policy. People in public health generally don't go into it for to become incredibly rich or famous. It's a very kind of Cinderella science. And so I think there it's really frustrating because you're like, the people advocating for vaccines generally are people who have seen these diseases, don't want them coming back, and want to prevent children suffering from them.
I mean, do you have any sense of why it is that in relatively educated societies like the United States, you have this almost deliberate stupidity
I think
that is anti-science and anti-established truth?
But I think it's almost that people think they're more clever. They figured something out that you haven't figured out. They're like, oh, you don't realize I've done my research. And it is worrying because like there was a Nature study recently that they said people like a statement and said, is this true or is it not true? And the longer they spent on the internet, the more they went down the conspiracy rabbit hole. So like the more research you do, the more educated you try to become, almost the way the web is set up, the more you start believing this kind of stuff. And then it's hard to come back to reality and say, actually, that's not true. This is, let's go back to facts. Let's go back to analysis. But I think there's not really any fact checking happening on the internet. If you look in the past, people got their news from mainstream outlets, they got it from newspapers, and there was fact checking. Like if I write something for The Guardian, it goes through fact checking. I'm accountable for those, and we have to look at the sources. And I guess same for being on a news program. The internet doesn't have any fact checking. You can say whatever you want. And so how is someone supposed to know the difference between a polished YouTube video of someone saying something and showing graphs and someone who's, it's very hard. So I also sympathize in the sense of people don't know what to believe anymore.
And when will we see the fruits of these policies in America? When will we see the declines in life expectancy and the increase in disease?
Well, we're already seeing the decline in life expectancy. That started before the pandemic.
Although that's not because of Trump. That's because of long term.
Exactly. That's there. I think now we're already seeing the rise of measles outbreaks. I think that will continue to see as vaccine rates come down. But I think we're looking at the next 5 to 10 years, especially if they take away healthcare, which is the other big one, right? Starting to pull back and roll back, some of the Affordable Care Act, which expanded healthcare for people. If you don't have healthcare, you can't pay in the American system to get help for cancer or even any kind of screening. It's extortionate. And so I think you'll see some immediate impacts in terms of if healthcare is rolled back. But I think, the longer term, 5 to 8 years of vaccines being pulled back and then outbreaks starting to happen. Will we see mumps outbreaks, rubella outbreaks, people dying of things that you thought this would never happen in America?
So, I mean, your vision is about us living long and healthy lives. Along the way, you're going to have lots of people who don't live long and healthy. They might live long, but they're living with disease, with dementia, with diabetes, all of these sorts of things. Are you sure you want us all to live longer lives, given that, you can't get rid of all of them? We can't all live long and healthy, can we?
Yeah, so I think that's why I chose 100. That's kind of the number in the book, I say, to live to 100, long and healthy with full capacity. And that's from looking at places like Japan and Greece and Italy, where you do see people making it to 100 in pretty good health. So I'm like, it's not 120 or 150. I'm saying 100 is attainable from other places. But actually, if you look at end-of-life care, most people say they want to live longer. Like you and me might now say, we're ready for death. When it comes, we're ready. But when it actually comes, most people do everything they can in the last week of life, including for their loved ones, to save them. Very few people, and this is look at the medical spending, you can see it goes there. They say, we can maybe extend it 2 more days, but it's going to cost this much. Most people say, try. So I do think it's quite funny that people are like, oh, I'll just smoke today and I'll be fine. And then in 30 years, they get lung cancer and they're just like, why do I want to live longer? Why did I do that? And
but
that
our demographics are not set up for us to support long life, are they, is the truth? I mean, there aren't enough children being born to work and generate wealth to pay for all of these old people who are not going to be working and going to be economically inactive and require huge health bills.
Well, I guess that's why. But the thing is, we're going to have an aging population, as is most of Western Europe and the States. That's just the fact of it. And we can talk about like the replacement fertility, but no place seems to have figured out how to get people to have more kids. I mean, I think South Korea was offering you a free pet if you had a child, and in Hungary, they'll give you like thousands of euros and dollars. And so I feel like we haven't yet figured out that problem.
I mean, but you buy into the fact that is a problem, is it? Because a lot of, I've got, kids who are 18 and 20, a lot of kids that age live in a world in which they think we have a population crisis and that there are too many people. And I spend a lot of time going, no, we don't have enough. We need more of you to pay for people like me.
Yeah, but I guess the tricky thing is that we are hearing, oh, we're overpopulated, we have too many people coming in, there's too many immigrants. But actually, if you look at it, that we do need the immigration, because if we don't have the immigration, we're not going to have the younger population to be able to support people in their elder age. So I think it's both there. It's both recognizing we need healthier aging. So at the age of 50 or 60, people aren't dependent on a healthcare system for 40 years. But on the other side, I think looking at the youth is saying, yeah, we're sub-replacement fertility right now.
What about dementia? I mean, is there any evidence that if you live a healthier life, that you reduce your likelihood of getting dementia?
Yes. So actually, one of the positive stories has been that we have managed, we always hear about this dementia tsunami of more people having dementia. Actually, at each age, you're less likely to have it. So a 6-year-old today is less likely to have dementia than one 10 years ago. Or when we turn 80 or 90, we're less likely to have it than our parents. So actually, there are progress made, and they say it has to do with, now knowing the importance of diet, staying mentally active, also early screening, better medications, better awareness. So actually, there have been progress made in dementia in the sense that we are learning more and more how to delay it. It's not inevitable. We're all going to die of something. But actually, there is progress in that. In contrast to something like cancer, where we're seeing the opposite. Actually, we're seeing people getting cancer at a younger and younger age. That's when I say the flip side is we're not doing as well on that.
And that's because of diet?
Well, that's hypothesis, not firm, but basically the cancers it's called early onset cancer. If you get cancer in your 30s or 40s or 50s, and the bulk of those are actually related to the digestive system. So that ties into ultra-processed food and changing of the gut microbiome. So people like Chris Van Tulloken, who wrote Ultra-Processed People, would say that actually it is linked. And I think Harvard researchers are actually trying to prove this link. But there is a puzzle of why we have younger and younger people getting something when our awareness and our ability to let's say, treat diseases should be getting. We should be delaying cancer. Instead, we're having the opposite.
You do end with a sort of manifesto of what governments should do. So let's just go through it. What's the list? So
the list was just 5 things. Because, of course, if I had a time with the government, say, what do you want to do? And the first is we need to figure out how to increase fruits and vegetable intake in Britain and make it more affordable. I think the numbers have been declining in terms of our awareness is up. Again, if you ask most people, they know it. They just don't implement it. So that gap. The second one is around active travel. So thinking about alternatives to cars, and in there thinking actually, how do we get this? And I do call for more public ownership of things, because public ownership of rail to make it more affordable. There's no reason that flying from Edinburgh to London should be cheaper than the train. So that's another one around pricing. Third one's around lay therapists. That actually, can we think of mental health provision in the sense of getting it out to communities and not just keeping it with GPs who are overloaded? So actually, can we figure out a way where we have a layer of triage that goes outside the core medical system? There's another one around the NHS. We talked about prevention and actually what would prevention look like. And I know you say that, getting an annual MOT or checkup for every person would be expensive or it couldn't be possible. It'd save a lot of money in the end. If people knew they had hypertension, like high blood pressure, they might actually be able to do something about it. Take medication, which we know is effective, or actually change some of their lifestyle habits, look at their overall work with a GP to work through their plan. And then the last one is around, actually, I talk about water and public ownership of water, which I know is a big debate here.
Why?
Because I feel that water, I talk about in the book, like the history of clean water, which goes back to Jon Snow and the cholera epidemic and the idea that actually you have to keep your water systems separate to sewage. And what has happened in the past 5 years in England, including in Scotland, but more in England, of kind of sewage just being pumped out to beaches, rivers, lakes, destroying not only kind of the ecosystem that's there, but actually harming people's health in the process. And that actually water bills have gotten higher and higher, and yet the provision of what you'd need to be doing with separating water from sewage just seems to have gone out the window. Like, untreated sewage should not be on beaches and lakes. It's very dangerous to human health. I mean, it's not just me. Chris Whitty, Chief Medical Officer, has written a report on this. And I just say, well, actually, if you look at water, it's a human right. It's a system that we need for our health, and it should be publicly owned so that it's accountable to people. And it is owned publicly in Scotland, because I know here it's a big debate. We have Scottish Water. It's accountable to Scottish Parliament. You have a real push for accountability. They still have sewage leakages. There's still problems, but they're dragged in front of Parliament because the shareholders are the Scottish public. They're not foreign-owned companies. So I basically go through kind of 5 things where people might say, oh, that's a ideal, fairy tale wish. And I say, but no, it's being done this way in another place. It's quite funny to watch the water debate here, being in Scotland, when you're like, it works well in Scotland. So why wouldn't you just have that system here if it works well there? And I know there's all kinds of historical issues of why that is and what it means. But when people say, what, publicly owned water? I'm like, it's happening in Scotland. And most people seem pretty happy with the provision and what you pay for it. And more money has gone into infrastructure. Our bills are lower. And the pay, in terms of the profits, all gets reinvested because it goes back to the shareholders. So it's just saying some of these ideas you think are crazy. Oh, publicly owned rail, publicly owned water, or thinking something seems crazy in one place, but it's happening in another. You can say that about guns in America. You've spent time in America. If you say to them, can you imagine not having easy access to guns? People say, oh, it's crazy. I'm like, that's other places in the world, and it's accepted here, right? And so I think that's part of the challenge, is saying to politicians and to the public, it's not crazy. If you believe it, it can happen. And this is how it can happen. There's a plan, and another place has done it. Learn from it.
I just also wanted to talk to you about, we think about public health purely as a domestic policy question. What role would you like to see public health considerations play in our foreign policy as a country? The way we look at the relationships we have, the impacts of things like the war in Gaza, poverty in Sudan alongside the war there, all of those sorts of things. How, if you put a public health lens on our foreign policy, what would happen?
Well, I think they're the easiest way to convey to people, because people say, is it in our national interest, or why should we do it? So there's obviously aid, that you just want to help people. But there I'd say infectious diseases, and why we have to be careful. Like, our biggest vulnerability from, and I've said this in the past, for global health security is something emerging out of Guinea or Malawi or South Africa, maybe now in the United States because of bird flu, and coming here and then spreading. So actually thinking about foreign policy in the sense of, how do we keep other places also having well-functioning healthcare systems which can detect? Because the way something new will be detected is someone walks into a clinic, it's unusual, a nurse sees it, doctor sees it, swabs it, it goes for sequencing, they say, uh-oh, it's unusual, we shouldn't see this, and then it gets flagged. But if those systems don't exist in other places, we wouldn't even know until it spread. So I think they're starting to think about foreign policy, because I know now there's a real lens of, what does it do for us? What does it do for the British people? Saying, actually, that's protection for us, because if it emerges anywhere, we're at risk.
So the undermining of the UN and the WHO, these are really big problems.
Massively, massively. I mean, coming back to the States, we've talked about kind of the vaccine agenda, but the other thing worrying around avian flu is, right now, avian flu is spreading among dairy cows in America. And we're seeing for the first time cow-to-cow transmission. That's mammal to mammal. We always thought of this as a bird, like an avian flu. It's in mammals. It's now one mutation away from spreading human to human. We've seen cow to human, but we've not yet seen human to human. The US under the Biden administration was doing regular briefings. I was able to attend them with the CDC, saying, where are the herds that are infected? Our countermeasures, these are the vaccines we're thinking of. This is our planning. These are, this is the screening. It's all gone now. It's all gone. There's no communication. And scientists within the CDC and within FDA have either been fired or been told you can't speak. So we have a black hole there right now. So actually, one of the biggest worries being here is if something emerges, when will we even know? Because we worry about the Guineas and the Malawis and other places, but it could be the United States because of the policy of, just saying we don't want to know, or they do know and they don't want to say it. But, right now, if they're anti-vaccine, you're almost anti-germ theory. So we're going backwards in that. So, yeah.
Just finally, I mean, the whole argument and thrust that you've made is that we need to understand that these are big systemic governmental problems, that it's not just about the individual. But what should the individual try and do? Yeah,
I think, vote. So I think one of the biggest things I've seen is disengagement with politics because they're all the same. It doesn't matter to me. I'm just going to live my life. So one thing is actually be engaged and vote because it makes a massive difference in terms of the policies that are implemented. And then the other thing I'd say is if you can move every day, like right now, we've been sitting a while, but just move every 30 minutes, hour, any kind of movement you can add to your life will add years to your life. I think it's the number one proven thing, exercise, in terms of having happy, because it leads to hope molecules. So it makes you happy, it gets you moving, and makes you have less risk of getting any kind of diseases and things like that. It's the evidence. We don't need more studies on the benefits of exercise. There's so many. So just move a bit more if you can. Probably not me, but I guess other people looking at their lives. So yeah.
Devi Sridhar, thank you very much.
Perfect. Thanks.
That's it for this episode of Ways to Change the World. Until next time, bye-bye.